What's up, everyone? My name is Dr. Mo, and I'm a dentist. Today, we will be watching a drilling of a cavity and a filling placement, okay, and adjustments afterwards. My name is Dr. Mo, and I'm a dentist. Push a like on the video, throw any comment in the comment section. It helps push the video in the YouTube algorithm. Okay, so this drill is pretty slow. I would assume maybe that's a low speed handpiece with regard to isolation. They're using a cotton roll isolation. There's an alternative method, and that is a rubber dam isolation, if you heard about it. The problem with the cotton roll is what you're seeing over here is happening. So the patient may push their tongue, which is full of moisture, saliva, and bacteria near the tooth cavity region. So it's not necessarily the best. However, if you have like a system that can push the tongue and you have a cotton roll here and sometimes put a cotton roll inside, then it can work. You can see how the assistant directly pushed the tongue. So that tube, the larger tube, is for a higher volume suction. The smaller tube typically is for a lower volume or low volume suction. So saying they'll clean, there's just the cavity here. I'm not sure why that instrument would be used. There's like a spoon excavator and other instruments that can be more helpful. This looks like a high-speed handpiece. Okay, there are different types of handpieces. There's high speed, there's low speed, there's ones with controlled speed, meaning one you can adjust as well. Okay, so they're saying etching, meaning they would etch the tooth surface, as in they're starting with the tooth filling steps. They're changing the cotton roll because, as you saw, the cotton roll that was used, it got really moist and wet, which is not good for the dental composite placement. Dental composite is this tooth color filling or type of filling that's very close to the tooth color, can be used in the back, sometimes also can be used in the front teeth or the anterior teeth because it's aesthetic as well. They will change it with a new cotton roll. Okay, it's more dry. We need to have a dry surface, really dry region to start doing our dental composite filling. The cavity looks a bit moist, so they're drying it up. So as you can, I'm not sure if you can see, but if you go back a bit, so there's some looks like dark brown spots or something. So a lot of people think the entire cavity should be like this, like completely white. It's not true. So if the dentist decided that the caries that are remaining, they're arrested and they will not cause problems in the future. Some dentists, I'm not saying all, may leave some arrested, okay, arrested, not active caries. If there is active caries, it should be removed. This is the etchant that they're applying. Okay, slow application. They're rubbing the etchant, I guess, on the edges, not the edge. Okay, so as you can see, they're waiting for a bit, for a period of time before washing out and drying the etchant after applying it. So they would watch the etchant, then they would dry the tooth surface. Yeah, so as you can see, I don't know, someone there, maybe the assistant or someone helping them said bonding, because next they're going to go for the bonding step. Bonding, as you can see. And they dry or they apply air on the bonding agent, and then they're light curing the bonding agent. By the way, for the light cure, in a lot of clinics, the dentist would prepare a protective eyewear for themselves and for the assistant, as well as for the patient and for the people who are close to the operating site. After we cure the bonding, they're applying composite. A2 that you saw here refers to the shade. Okay, so this looks like composite. It will need to be packed, and surprisingly, this instrument that you're seeing is actually called a plastic instrument. And so that's what it is called, to help shape and push the composite. They're using the plastic instrument to adjust the composite. Okay, and then as you can see, they will light cure the dental composite, because dental composite is a light curable material. It needs to be light cured. So I cannot really see the final result. So next they will do some adjustments and polishing, because we don't want the filling to be rough in sensation. If you're wondering why is there a light, some handpieces, they have a light with them, and helps the operator to see the operating side better. So they adjusted the filling. It looks good. Okay, and I think that is about it. Pretty straightforward, pretty simple. Oops, what is this? Okay. Thank you everyone for watching. My name is Dr. Mo and I'm a dentist. Put a like on the video, share your experiences in the comment section if you ever had a filling before, or if you're going to have filling pretty soon.